The high costs of healthcare means that for some families, there will be less holiday cheer and more bills that are not covered by health insurance this holiday season. So joining us to discuss the 2020 Aflac Healthcare Issues Survey is the Senior Vice President of Broker Sales at Aflac, Stephanie Shields. So Stephanie, what are some of the findings from this 2020 survey?
Good morning. Our survey findings showed that medical costs are impacting families' ability to enjoy this holiday season. It's the second time that we've run this survey, and over the past 2-year period, over 75% of respondents reported that they were going to be making some difficult decisions on their spending this holiday season.
So what type of sacrifices or hard decisions are people having to make because of healthcare costs specifically?
So 'tis the season for giving, but for some, 'tis the season for cutting back. And that often comes in the form of fewer gifts under the tree, foregoing some trips to be with family and friends over the holiday season, or even some risky debt like taking on credit card debt. For example, our respondents who had a trip to the hospital over the past year, over half reported spending $1,000 or more in their own out-of-pocket expenses. That's about what consumers plan to spend on gift giving this holiday season. Therefore, many families are forced to make difficult choices.
So how has COVID-19 and the pandemic impacted this holiday season for families?
So COVID was number 3 in terms of the ranking on conditions that people reported impacted them or their family members. And I'm a mother of 3, I'm a businesswoman. I have seen firsthand how COVID has changed the way we learn, the way we work, the way we interact socially, and a lot has been uncertain, but a few things have remained constant. Whether it's COVID or other serious health conditions like cancer or heart attack, these things create a lot of unplanned expense for consumers, and American families are generally unprepared.
Now, because of these sacrifices and the high healthcare costs, are some families having regrets about the decisions they made previously regarding their healthcare?
Yes, absolutely. And that's one of the first things that people do is they reflect on what are my benefits, what am I covered for, and what are my expenses when they have a medical event. Hindsight is 2020, and the benefits decision-making process is very complex. Over a third of our respondents reported regret with their benefit choices. And that came in the form of limited benefit plans, high copays, deductibles, or really not understanding how out-of-network costs affect them. And so health insurance alone doesn't always cover the cost of medical care. And so that's how Aflac can help. We cover expenses that health insurance doesn't.
So were there any other interesting findings that stood out this year from the survey?
Yes, absolutely. You know, we're all talking about holiday spending. It's December, but this happens to families all year long. And so whether it's credit card debt, loans, or even more importantly, skipping those trips to a doctor visit or a hospital for themselves or their family members, Aflac wants to create a safety net for consumers. Our supplemental insurance products like critical illness or hospital, we pay cash benefits to the individuals directly. And they can use that however they want, whether it's for their medical bills or everyday expenses like their rent, mortgage, or childcare. We're here to help.
So where can we go for more information?
For more information on Aflac and supplemental insurance, please visit aflac.com.
Stephanie Shields, thank you very much.